I would like to introduce Pernille Gregersen, who I am pleased to call a friend. I met Pernille at the One Retinoblastoma World in Toronto in 2014, and she spent some time in Australia on sabbatical a few years ago now. I then had the pleasure of spending some time with Pernille in her native Aarhus in 2019, when we could still travel. Pernille is a clinical geneticist and senior consultant in the Department of Genetics at the Aarhus University Hospital. She has a special interest and dedication to retinoblastoma genetics and survivorship, and Pernille is going to lead us in understanding more about taking care of our mental health. Thank you, Pernille.
Thank you so much, Sandra, for your presentation. And thanks first to Sarah for a wonderful presentation, your own experience, and you are a role model for all, and then walking through all these beautiful survivors around the world. You're doing an amazing job. So thanks, Sandra, for letting me lead this session on mental health, which is obviously important for all human beings. I am humbled to start this session with a short presentation, and then we have two important speakers from Australia afterwards. So preserving positive mental health, that is a huge question that we will try to address. I want to start by saying that I am sitting on the inside of the walls. I am not living with retinoblastoma, so I am so humble for the survivors, the families relating to RB that are the real experts on this topic. I will start a little bit about talking about preserving positive mental health through adult survivorship from diagnosis and through to adult survivorship and how to do it. And then what we as clinicians need to look after ourselves, how we do that. So mental health in retinoblastoma, why is that important? As we have heard from many stories yesterday, from survivors and from medical professionals, retinoblastoma is a lifelong condition, and it impacts several aspects of survivors' life. So from the very beginning, the diagnosis in childhood, the many examinations under anesthesia that can be post-traumatic, later on in life, the vision impairment, the physical appearance, the possible social implications from having impaired vision and a different appearance. And then later on, especially in heritable retinoblastoma, the risk to children, the risk for second cancer. So it is important to look out for mental health in RB. It is important to focus on mental health lifelong, because retinoblastoma is a lifelong condition. Though, as we have heard from presenters, the key is also balance, because we don't need to over-medicalize retinoblastoma. We don't want to see limitations. We want to ensure fulfilling lives, and as you said, no limits because of retinoblastoma. How do we do it? That is the very good question, and I don't have all the answers to that. My experience is with retinoblastoma and other rare genetic conditions with lifelong implications, we need to be brave. Survivors, families, healthcare professionals have to have the courage to be open and talk about what is difficult. We have to focus on the human being. We need to have a holistic approach and not just focus on medical issues. I think we are getting better at that, but we still have some improvement. I think that all the efforts that are done by our child life specialists is really important in order to pay attention to these issues that can affect mental health. We also have psychologists, therapeutics, etc., that can help us. Who are we then? When I write it down in bold, like the last sentence in here, we is the healthcare professionals, but indeed the families, the parents, the entire environment that are a part of an RB survivor's life, from childhood to adulthood. We need to share all our experiences. One RB World meeting is an unique platform for doing that. We can care for each other, we can share, and we are stronger together, opening up for these different various implications of retinoblastoma throughout life. In Denmark, we have evaluated our RB survivorship program, RB survivorship clinic, and have focused on how we in the future can be better at evaluating the psychosocial issues that can be varying over life, the age dependence there is, the various impact over life. And we want to do this in order to support RB survivors to develop the coping skills, the compensatory skills, and ultimately build the resilience that are needed to keep a positive mental health throughout life in RB survivors. Again, we have to remember we are all different. We need to take an individual approach when doing this. We have to focus on the very fine balance, not over-medicalizing human beings, RB survivors, not defining them, as you said, Sarah, by their condition, but still keep in mind that there can be issues that we have to find and do what is relevant, do the appropriate intervention timely in order to preserve the mental health as good as possible. Again, sharing between each other and caring is what I think is a game changer for many. I see it from various conditions, talking to survivors, talking to parents. We can, as healthcare professionals, talk a lot about our experience, but what really matters is when they sit next to a family, next to a survivor, next to a patient that has the same experience living with the condition, living with retinoblastoma. So we need to share, we need to be courageous and open about what can be difficult, even though it hurts. 2 slides about us inside the walls, the healthcare professionals, nurses, optometrists, physicians. There are many of us with different backgrounds. Why is it important? It is important because we need a balance too. We are not machines. Sometimes we may look like machines, but we need to keep a balance. How to do it? That's very difficult. I think what we can do again is sharing our medical difficulties in our work. We need networks to do that. We do it in our local clinics. And I think we are so trained in doing that, so it's not that really big of a problem. The largest problem is what I would call the mental issues. The medical issues we have done for years, multidisciplinary conferences, etc., international conferences, talking about these medical issues. But what I call the mental issues or emotional issues that are encompassing workload that can be too big, organizational frustrations, burnout, how to keep working motivated despite some of these burdens in the work life today. I think what characterizes all the healthcare professionals I know that work with retinoblastoma and within many other fields is a high dedication, a very almost destined feeling of destiny working with these conditions, and that is very good. However, it could be a two-edged sword. It can easily lead to burnout because of the burdens of the work. Working with RB survivors, there is a pressure, there is very often a long life connection to the families, to the survivors. So how to balance that you are there as a professional, not getting overwhelmed, not getting burnt out by this. I think really what is most important is that we as physicians are open and courage to share what we are working obstacles are. So if I should wish for something, is a more organizational setting where we can do this, also internationally. Also, in order to share our positive moments. Sandra and I have a research collaboration. We can share when we find do new observations. We get to exchange working moments, obstacles in our work life. And I think that is really a gift and one of the many benefits from the One World initiative. So thank you. So this was just a short introduction, and I will stop screen sharing now. Then it is a great pleasure for me to introduce the next presenter. This is Olivia Larkens, who is a certified child life specialist who has worked at the Royal Children's Hospital in Melbourne for 11 years. For the past 6 years, Olivia has been supporting children with RB who has been coming for regular examinations under anesthesia, and she has helped to implement a range of strategies to improve their hospital visits through promoting positive experiences and normalizing the hospital environment. Olivia, please welcome and thank you for presenting.
Thank you. So I'm going to talk about mental health strategies and how it can impact on the whole family and how it involves the whole family, whether it's about coming to the hospital and around procedures and everything, but also things that maybe families can be doing at home to help to promote some coping throughout the child's and the family's life. So the first graphic that I've got on the screen is just really to, I guess, represent that the stress of the parent coming into the hospital environment and everything can have a direct impact on the child's distress as well. And then, of course, when the parents begin to see their child becoming distressed, then that also impacts back again onto the parent's stress of the whole situation. So one of the things that we're going to talk about today is just about how, as adults, our attitude and intentions can set the tempo and the baseline of calm for children. So yeah, mental health strategies are a family affair, and it can have a huge impact on the health and function of the families if parents have to take a reluctant or distressed child for a medical procedure. A child's healthy development depends on our ability as adults or as a parent to reduce the perception of threat so that young children feel safe and need not to be concerned with fear or pain. So we really want to set the children up so as they can come into the hospital and have a positive experience and not be worrying about what's going to be happening to them when they come there. So then on the next slide, we're going to talk a little bit about coping. So we understand that a lot of parents might need to understand their own coping style a little bit better and what they might need to help them cope in the hospital environment. We understand that everyone brings with them their own experiences that they've experienced, could have been as a child, experiences that they've had or experiences that they're currently going through, and how these can have an impact on the child, on their child and on their coping. We also want people to have a bit of a think about what they might need to cope effectively. Everyone needs slightly different things. And I guess one of the main things we want to promote is that not to be afraid to ask for things that you need to help you cope more effectively. So I guess that when we have an understanding that, or when parents gain an understanding that their behaviour and emotions can have a direct impact on how their child experiences the hospital and procedures, we have a very powerful tool. So what we really ask for parents, and sometimes some parents might find this a little bit challenging, is we really want parents to be modelling the behaviour that we'd like for your child to learn. Can be feelings of nervousness and anxiousness can be quite contagious, and children will pick up on these vibes, even if you're trying your hardest to cover them up, because your children are always looking to you for cues as to how they should be responding. So any control that you can take of your own feelings and promoting your comfort and calm is going to directly impact how your child presents. There has been some research that has shown that parents who have rated themselves as more anxious about their child's medical treatment have shown to perceive their children's fear, distress and pain as being higher than less anxious parents. So yeah, we just need to, and like we said, as I just said earlier, that parents have their own memories of childhood, and that might not be about, it could be coping in general, it might not be in relation to medical procedures or anything like that, but they're going to bring those things with them as well that I guess we as clinicians need to be a little bit aware of, and it's part of our responsibility as clinicians to acknowledge that some of these challenges and to help highlight the parents' strengths in dealing with those challenges. And it could be something, I mean, I can speak from my own personal experiences of having medical treatment before, when I was less than 12 months of age, and I still cannot to this day walk into that hospital without it triggering something in me. It's the smell of the hospital totally sets me off. And I know it's doing it to me, but I cannot control that. I remember nothing of the medical procedures or anything that were happening to me, but that smell of that hospital, and it's only that one hospital, absolutely triggers something in me. So I guess we need to be aware that parents and adults can come with those things in their background as well. The other thing we want people to consider is that I think we need to acknowledge that parents are an important part of the healthcare team. And for some people who have had a history as being a patient, it can be a challenge to transition from being a patient to being a parent who is actively involved. So everybody has got a part to play in the care of their child, but we have to acknowledge that healthcare professionals and parents are authorities on different subjects. We need to remember that you know your child better than anyone else does. And you can be a great source of knowledge if we as clinicians can tap into that knowledge and use it to help inform how we can maybe help your child in a better way. No, I think as clinicians, we also need to be very aware of, we need to involve the parents in, which I think most people would do an amazing job of, but giving them a chance to be involved in all of the conversations and everything that's going on, and also giving them the chance to be listened to and recognised as a competent partner in the care of their child. I'd like to encourage parents to speak up and not be afraid to, tell us what has and hasn't worked for your child in the past. There's not only one way of doing things. If we've done something differently in the past and that worked really well for you, don't be afraid to speak up and say, can we do it this way again? Because we found that was most beneficial for my child. We don't have to go with the standard way of, no, this is the way we do it, and that's just how it is. Please speak up and let us know if there's something that has worked better that we can help you with. I think the other thing, that the way parents can be an important part of the healthcare team is to be taking an active role in procedures and things like that. So parents can do a fantastic job by providing comfort positioning, sitting with their child on their lap. They might be the person providing some distraction to their child and the person that's speaking to their child and offering reassurance throughout the procedure. Giving the parents that active role can greatly help them to cope better as well. And if we can give them that the opportunity to provide that support, there has been some research that shows that it can lower the perceived feeling of fear and threat for both the parent and the child. So the next slide, we're going to talk about different types of stress. So there's 3 different types of stress that we can refer to. So there's things like positive stress, tolerable stress, and also toxic stress. So positive stress is moderate, short-lived stress responses. such as brief increases in heart rate or mild changes in body stress hormone levels. This is fine. This is a fine type of stress. Everybody experiences these things occasionally. The next type of stress is tolerable stress. So stress responses that could become toxic, but generally occur for briefer periods and in time for the brain to recover and reverse potentially harmful effects. And then the third type of stress is toxic stress, strong, frequent or prolonged activation of the body stress management system that has harmful effects on the brain's architecture. So I guess one of the things we need to be considerate of is that as we're not expecting, with all the interventions and things as clinicians and as child life specialists, and that we're not expecting that we're going to be able to eliminate stress altogether around medical procedures, but our greatest aim is to minimise that distress. I think one of the things that we need to be aware of is that to cry and protest is developmentally appropriate way for infants and young children to express their feelings. Thank you. But what we want to be aware of is that we don't want this to become toxic stress. So if your child does become distressed during the procedure, it's important that we can have things in place to reassure them, possibly with a hug at the conclusion of a procedure at the end of eye drops, and then redirect their focus elsewhere. It could be something like a novelty toy, a favourite show, food if possible, if they're not fasting. So what we'd really like to aim for is keeping children in the realms of the positive stress or tolerable stress, and we want them to be able to return that to that baseline in between events and not get into that toxic stress where they're constantly in, you know, a heightened state and not able to engage in other things. At the same time, like I acknowledged just earlier, that, you know, crying and protesting is totally developmentally appropriate. If we have a child that just sits there and especially a young child that just sits there and lets us do anything to them, they're not engaging, they're totally withdrawn, that's also an absolute flag for us as clinicians that we need to be putting in some extra work as well. So just, yeah, understanding that some stress can be good. Thank you. So just some of the strategies that I'd like to talk about. So these are all things, and Morgan actually touched on some of them yesterday in her keynote presentation. Some of the things that we can be doing and as a family around healthcare interventions. So we can be looking at things like breathing techniques. There are some amazing apps and resources available to promote breathing strategies. I suggest going and exploring a few and find one that might be right for you and for your child, and rehearse some of those strategies at home and where you're feeling the most comfortable. We can provide you with strategies and all those sorts of things in the hospital environment, but if the child's already in a more heightened state in that environment, they're not going to be taking on learning new skills and everything all the time. So it's really great if you can rehearse some of these things at home. And as Morgan said, was speaking about yesterday, doing it consistently, introducing them bit by bit. It might be 5 minutes before bedtime with a child and just talking about doing 4 or 5 nice big deep breaths together. And if that becomes then an automatic response, and you and your child have a way of doing it, of incorporating breathing techniques together, when it comes to a time where there is going to be a stress point, that's something that you can fall back on because you've already rehearsed it, and we're not trying to introduce something new at a time of stress. Focus on the positives and use positive language. You know, I guess we're very lucky that we can provide some amazing resources for the children to use. We can, you know, provide children with play opportunities when they come into the hospital and all those sorts of things. So we have a real focus on what the fun things that are that the children can do when they come into hospital, and not focusing on the actual procedures as much. Obviously, we want the children to be aware of what's going on, but that's not going to be our main focus. So we really want the children to be able to build some positive memories and associations of coming to medical appointments and building positive memories. We have one of our anaesthetists who is absolutely fantastic, who is more than happy for parents to be taking photos of the whole process of what's going on when the child comes into the hospital. So if they're having something like a pre-medication for midazolam that can have an amnesic effect on them, and they may not remember elements of what's happening, that they've got these photos that they can refer back to and look at next time and say, oh, look, here's a picture of you. Look, you decorated your mask with stickers and you were choosing the smell that you were going to put in your mask. Here's a picture of you that is looking at playing with some of your favourite toys at the hospital and things like that. So we've got these positive associations with coming to the hospital. Also looking and using positive language, and kids are quite happy with just a simple explanation, and it might be something around eye drops that is like that the eye drops are to help the doctors to get a good look at the back of your eye, or if they need to take some medicine, this medicine is to help to make you feel a bit more relaxed, or take away some of your worries. So just very simple explanations to the kids, but using positive language. I guess one thing, and I think all of us are probably guilty of doing it at some stage, is using or giving mixed messages of saying one thing, but our body language is conveying something else. Quite often we probably don't even know that we realise that we're doing it. But a really common example is trying to reassure children by saying things like, don't worry, it's all right, you'll be fine. So even very young children quickly learn that their parents usually say these things when things aren't all right. And it quite often puts some children on the defensive and can actually make them more distressed. So try, and it sort of to a degree minimises how the child is feeling as well. And I guess another thing that came out yesterday is even giving children the opportunity, or I guess rehearsing and working with your child. If their children are normally curious creatures at the best of times, and other children will be asking questions and things like that. So if your child's going to daycare or something with a patch or with a prosthetic eye and things like that, giving them the chance to rehearse responses to different questions, that so they're not feeling as though they're put on the spot, giving them the language to use when somebody does ask them about their eyes and things like that as well. So again, some of that rehearsal at home. I guess develop another thing that we've found that can help with children is developing a routine around medical interventions and hospital visits. So we've got some families who like to make a day out of it when they come to their hospital, and they create their own special routines for those days. We're incredibly lucky at Royal Children's Hospital that we have, a 2-story aquarium, and we have meerkats and things like that. So lots of kids' visits focus around those things. Before they go to any appointments, they go and check out the aquarium, or then after their appointment, they'll go and see the meerkats, or they'll get their favourite takeaway, an ice cream or things like that. So again, that's to help promote some of those positive experiences and associations with the hospital. Again, as Morgan mentioned yesterday, providing a child with opportunities to engage in medical play. Just for familiarisation, ask staff if you can take some of the medical equipment home. We quite often encourage families to take the anaesthetic mask home with them, give them some strategies about how they can use that and incorporate it into play. So, they're great for blowing bubbles through them and stuff. They're great for floating in the bath, all those sorts of things, different ways of playing with them so as they aren't something that's threatening to your child when they come to the hospital. Having a toy doctor's kit at home and just leaving it for your child to explore and use the different medical equipment on soft toys, dolls, all those sorts of things. Or maybe even them choosing to make you as the patient, which is also a really good opportunity for you to model some of the behaviours that we would like for you to be teaching your child as well. So behaving some of those appropriate responses and coping strategies as well. Things like It might be they want to give you an injection or something. You might articulate to your child, well, I don't like to watch when this is happening, so I'm going to look away and I'm going to take a couple of nice big deep breaths. So you're just sort of dropping in those strategies that kids can use as well. And then promoting positive touch is also something that Morgan mentioned yesterday. You know, children have the tendency to react negatively to sensations of touch. And a child can be overly sensitive to tactile input that others would hardly feel. This can be because their immature central nervous system is unable to manage the sensation, and the child may react with flight, which is avoidance or withdrawal, or fight, anger and hostility. And certain parts of the body may be particularly hypersensitive, such as the face, mouth, hands and feet. And of course, with RB, we're talking about putting in eye drops and being around the child's face and all those sorts of things. So any things that we can do at home to allow positive touch around the face and normalising that positive touch can be a great thing. And it might be through games, it might be through covering eyes and playing peekaboo, all those sorts of things. It might be just getting your child used to you rubbing under their eyes or across their eyebrows and things like that. And just again, in the safety and comfort of your own home, putting some of those things in place to help the child become familiar with touch around their face. And then I think that's just about it for me. The next slide. So hopefully if we can put some of these strategies in place and we can get parents coping better, we're also going to get the child coping better. And then obviously when the parents are seeing their children coping better, they're also going to be cope better and feel less distressed. And then I think the next slide is just some resource, is the list of references. And that's it for me.
So I'm pleased to introduce the next speaker, who is a young woman from Brisbane. It is Grace Dillon. Grace was diagnosed 5 months old with bilateral retinoblastoma and lost her left eye 2 years old. Grace is gonna focus on the little things that impact her life with monocular vision, as well as the unprecedented struggles and experiences that accompany experience of a condition that occurs almost exclusively in infancy to early childhood. Grace indeed knows and lives with the unique challenges in growing up as a retinoblastoma survivor with one eye, and you'll share some new perspectives for both parents and clinicians on how growing up with monocular vision is a learning curve and sharing experiences can be beneficial. And excuse me for not being good at monocular vision, my Danish accent here. Well, welcome Grace, and please don't be stressed with the timing. We have time enough in the question and answer session, so please go ahead.
So yes, I'm Grace. I'm 17 from Brisbane. I'm currently finishing up year 12. And the inspiration for this session is, for me, in my experience of retinoblastoma being monocular, often the things that are the most challenging or actually influence my life the most are absolutely random little things that are sort of just picked up along the way, different patterns, and especially managing sort of sharing my story and the social aspect of it as a kid and growing into teenage years as well, because it is a very sort of heavy topic for kids to hold for themselves, but also to be able to share to others. So that's the main points that I'll be making. So the three main sections are just the random challenges and adapting to them. The trauma balance between me and my parents, and I'm sure that would be shared for many other survivors as well. And the third one is how to open up with peers and how to develop those strategies from young childhood into teenage years and of course after as well. And just to very quickly mention, I've been very lucky with the vision that I've kept. And so this is absolutely very, very specific to my personal experience, but I'm sure many others would be able to relate as well. So I'll just start off with a little summary of my story. There's just a photo there of me playing with some toys, probably 1 or 2 years old, and you can see a very clear, visible white reflex in my left eye. So I was diagnosed with bilateral retinoblastoma at 5 months of age. in April 2004, and my parents noticed that my left eye just was not looking quite right, and the pupil was almost translucent and would have a white reflection in photos. So after lots of appointments, they found 4 tumours in my left eye and 3 smaller tumours in my right eye. And after chemotherapy, cryotherapy, radiotherapy, and eventually I had my left eye removed. I'd just like to kick off the session with a little bit of an activity, and it doesn't require too much effort, but I've got the instructions here. So if we could all hold your hands out in front of you, about 8 to 12 inches away from you at eye level. Point your index fingers towards each other, touching at the fingertips, and look through your fingers into the distance behind them. So for those with binocular vision, you're probably seeing something a little bit like this. For those like me, this looks insane and completely bizarre. And I couldn't compute that when not focused on something, it actually makes the little reverse tiny finger in the middle. Absolutely blew my mind. But this is a photo by an artist. His name's Alexander Rosenberg, and he does a lot of glass art. So he actually made a little extra digit, which is just 2 sort of tops of the fingers reversed out of glass. And so this image isn't edited or altered at all. But it really blew my mind when I saw it, because I had never really imagined that the 2 perspectives would be anything other than a little bit more to the left of what I could see. And it didn't register in my brain that that was something that vision could do. And so I thought that was a perfect example of how the little things that we would never anticipate are different, that we might just not know. Okay, perfect. So just talking about the real and completely random challenges that I have found and faced and adjusted my routines around. So in primary school, this is a little bit of a game that we used to play called Silent Ball, which was essentially you would just throw a ball around the classroom to different people, and you would have different restrictions. So it could be like stand on one leg or something like that. And I remember in about year 5, we were playing it and one of the teachers goes, "Close your right eye." Like, uh-oh, that's not going to be great. And I just closed my left one and hopes that no one would see. But in a situation like that, I just wouldn't have anticipated ever having to think about something like that or make an adjustment. And at the time, I was actually quite anxious about that. If it was past me, like I could be out because of my left one, and then I'd have to tell the whole classroom. And it's just little moments like that that stick with me, because it's really tough for a kid not knowing when to share, not knowing how to adjust to those little situations that come at you when you're not expecting it. As you can see in the photo, I did HP in year 10, and one of our units was badminton. And while that photo might make me look quite sporty, I've actually cropped it so that you couldn't see that I've completely missed the shot altogether. I have not hit it at all. And in fact, for that assignment, I had to try and write about the motions and strategy for badminton as someone who had never actually successfully gotten the video of me hitting hitting a shot over the net. And it was absolutely hilarious in class, but it was a little bit more confronting when I had a conversation with the teacher and found out that she wasn't able to adjust her marking strategies for that challenge. And badminton was one of the senior units, and so I ended up actually having to drop HPE because my badminton ability was absolutely shocking. And absolutely dragged my mark down. Like basketball and stuff like that is fine, catching something bigger is fine. A tiny little shuttle that makes no shadow and doesn't really change in size when it's coming towards you, shocking, could not get it. So yeah, that's just another example of sometimes the things that do end up being challenging completely come out of nowhere, and it's just being able to adjust as you go and have those conversations with teachers is really, really important, and something that does take quite a bit of time to develop. So it can be quite taxing to be able to adjust as you go and move through and be able to face these. But I think as soon as you find strategies and find methods and routines to be comfortable talking about how impaired vision actually changes day-to-day situations and communicate very clearly what you're facing and what you're experiencing as a result of it, it makes a massive difference, and it does take a lot of practice, but it's definitely something that's worthwhile developing. The next thing is a little segment on the shortcomings of binocular cues. So being able to perceive depth through angles, shadows, size, object placement is just an incredible feat of the human mind, but there are limits, and sometimes those are things that you wouldn't even expect. And for me, I've noticed that the colour yellow is shocking because the colour yellow reflects almost all light, and it's always very bright, and so I really struggle to see shadows as well. And usually that's fine. For example, in badminton, I could sometimes hit the white one, but I could almost never hit the yellow one. But it becomes a little bit more challenging, for example, when there's a speed bump that you thought was very small, but it turns out that it was not very small. And it is painted yellow. And so I would hit that and then go bouncing around in the car and absolutely scare myself silly because I just didn't see it coming. And so now if I see a yellow speed bump, I'm a bit more cautious around it, whether it is flat or not, whether I'm confident it's flat or not, because just in case I miss it. And so those things, being able to, I guess, register the actual patterns that could make little impacts and adjust day-to-day routines to be able to accommodate for that, or just make sure that it's not going to make an impact, can be really important as well. Yes, okay, so making adjustments normal in those situations can be absolutely game-changing. Sitting in a specific place in a classroom is something that I've definitely had to work through. So for example, in a normal class, I'll probably try and sit in the middle or over to the right side so that I can, left side, so that I can see everyone and see the teacher and be very involved in the classroom. But if I'm taking an exam, I will try and sit on the other side of the wall so I can't actually see anyone at all. And it's almost like I have blinkers and I don't get distracted as well. So it can be an advantage in that way, but it makes an incredible difference just registering how those little things can change your experience in a classroom experience as a kid, going through those very, very typical routines. On a similar line, I did rowing competitively for the last 5 years. And I'd find that with the lanes, if I was on lane 10, which is the furthest to the right, I could not see a single other boat for the entire race, and I had no idea where I was, and those were so challenging races to get through. And so I would look ahead at the lanes and see where everyone else was and be able to plan ahead for that. And it's just really having an awareness of those little tiny quirks and changes that happen pretty much all the time. And the other thing there are strengths as well to being monocular, and there are cool little quirks and stories and stuff you can have. And it wasn't until probably a couple of months ago that I realized I knew it, but I didn't quite comprehend that I don't have to have 2 blue eyes if I don't want 2 blue eyes. I could get a prosthetic that's green, I could get a prosthetic that's purple, and it's a great conversation starter, but it can definitely have upsides as well. Just having a really good awareness of what being monocular means to you and how it influences your life. And the other thing in finding strengths, which is a little bit on a different note, but just being able to accommodate so that the appointments that you're familiar with or the routines in daily life, being able to plan ahead for making as seamless an experience as possible. So for example, with my current appointments, if I have the pupil dilating eye drops, often I will bring in a book, but before the appointment, I'll download the audio book of the same book And so before I get the drops, I can just read it in the waiting room. And then after I've got the drops, I'll listen to it from the same point. And it becomes so much more seamless and manageable on that day, just because I'm not trying to change my routine. I'm not looking at my phone and going, oh my goodness, I can't even log in. It makes things so much more peaceful and calm on those appointments that I used to completely dread. So yes, the next little topic that I have is about the balance of trauma for parents and for survivors. So this is a photo of me just after my left eye was removed. So I look a little bit happy there, but I'm sure it was not a quiet time in the household. So the old reality of retinoblastoma is that because it occurs so young, I have no memory of the original treatment. In fact, it's interesting talking about smells. Probably the only real association I have is sometimes I will literally have to leave a room because something will smell like the anaesthetic so strongly. And I can't even put my finger on it, but it's just very, very much in my mind. But in terms of actual treatment, there is very little memory that I actually have. And so it's a very interesting sort of dynamic in the end, because it turned out that the clinicians that helped me and my parents who supported me through it actually have probably a closer experience of my cancer than I ever will, which is, it's very strange. Like, I am very experienced at being monocular. I'm very experienced being an outpatient, but I don't have much experience of being a patient because I can't remember any of that. And so while I am a survivor, I have no comprehension really of what I survived from memory. And so it is very difficult, because sometimes when I'm sharing my story, I will quite genuinely say, I'm okay now. It actually doesn't change too much in my life. In fact, it's probably harder on my parents than it ever will be on me. And it is often mistaken for humility, but I think it's a very important conversation to have, because I definitely feel that way, but I'm sure lots of parents, there is an element of this wasn't mine, so how could I be more hurt by it, which is probably difficult to open up about. But I think it is really important, because it's definitely something that I've recognized, and it's a challenging sort of dynamic to adjust to. And on that similar note, I often find that I'll go to appointments and not know answers to some of the very simplest questions about my treatment. And I would love to be able to move into a stage of independence with my appointments. But the fact of the matter is that my mum will always remember the names of the doctors, but I will always need that note on my phone to remember the stages of treatment that I went through and the answers to those questions. So it's very challenging to try and go through that transition, but I think being able to have those open conversations and just recognize that this is like a very real and very valid and important thing to adjust to and work through, especially as well moving from the children's to the regular hospital is similar in that regard. And I can't fathom what my parents went through. My mum wrote a little diary, and I read it a couple of years ago and was just shocked. I'm like, I can't believe that I went through that, and I can't believe they watched that, because I had no idea. And I was reading my life back in a diary, but I just couldn't believe that she and my dad had to support me through that. And I've just been running around making jokes about having one eye, which is totally fine. But it is something that I think it's really important to have that conversation, and reading that made a massive difference to me, and being able to actually open up about, you don't just have one eye, you went through this, made a massive difference for me, understanding that experience. But there are some anecdotes. I'm sure I wasn't an easy toddler to manage, but I actually, when I first got my prosthetic eye, completely cracked it, hated it, and for the first night, kept shoving it under the door of my bedroom because I couldn't stand it. I thought it was awful, and so I'd like flick it into the hallway under my door. And it's very funny now, but my parents must have just been going, what are we going to do about this? But it's all just, yeah, really important to have those open conversations and be able to share the real depth of experience between a parent and a survivor, because that's totally changed my view and my mindset and how I would like to respond and support and talk to them about all of this as well. So the last sort of segment that I'd like to get onto is how to be open with peers, especially as a kid to young teen. So I've spent years and years practicing how I will tell people that I have one eye, and it's a very it's taken a lot of practice. I used to sort of hold the attitude of, this is, if it's not hurting me, then how could someone else be hurt by me telling them? And so often I would say it in such a casual way that it would really take someone off guard, and it's very difficult to be able to have those conversations, especially with kids who might not understand and just hear the keyword cancer and be very caught off guard. And so I think the most important thing is being able to develop a very clear strategy to be able to make someone else feel comfortable, and in someone else feeling comfortable about knowing my story, asking questions about my story, it makes me feel comfortable reaching out to them to ask questions or ask for help or ask for accommodation for something because I'm struggling a little bit with it, without it being a big conversation, without it being the massive I have to tell you this because it is a result of me having one eye sort of case. And so I've ended up with a little bit of a recipe, I guess, for the I had cancer talk. And so I think I will always start off with, I'm okay now. I'm not still undergoing treatment. I still have like appointments just to make sure that everything's fine, but this isn't a sad story anymore. This is just something that I've been through. And then just doing the basic sort of, I had retinoblastoma, I have a prosthetic left eye. And for me, I am comfortable talking about this on a very casual level. I actually prefer it. And so I definitely like to make it very clear to anyone who I'm telling that you can ask me anything. You can like bring this, you don't have to have a conversation just with me to bring it up. I'm okay with you saying something if other people are around, and that's all good. And that's very much something that I've, it's definitely a result of where I'm at with my view of everything. I'm comfortable with that. But I think sort of the most important point of having this recipe, I suppose, is really having a guide to how I want someone to be able to respond to it. So even I know I would sometimes use on a scale of 1 to 10 for how sensitive you should bring this up, like a 1 is fine, I'm okay with this, or anything, I'm okay with jokes about it. I actually make lots of jokes about it. But whatever someone's position is on it, it's just really important to be able to make sure that the person that they're telling knows the response that they want, because the very complicated truth of empathy is that it can be quite selfish because of the uncertainty and not wanting to hurt someone, not wanting to say the wrong thing. And so sometimes it can be quite isolating. And so being able to just have a guided response and let someone know how you need support in this and what you need is the most important thing. And I found having that little list of being able to routinely tell someone has made a big difference as well. So as a result, my friends actually feel comfortable enough to make jokes about it, bring it up in conversation. But on the other side of that, they will always automatically walk on my right side. Whether I say something or not, my friends will always walk on my right side, which on the photo on the left, you can see us walking away and I'm on the left. And then the photo on the right is us all posing. But it's just little things like that, because I've been able to develop that with them and bring up the little accommodations that I need and have that very open conversation through that practice and that development. They don't even think about it anymore. We'll be walking and they will move so that they know that I can see all of them, or they'll save me a spot to the left of them if they get to an assembly first. And it just makes life so much easier knowing that my support circle, I don't even have to say anything. So that's definitely something that is, I think, very, very important, just being able to really establish that connection with friends and be open about it. And I know that a big thing, of course, is kids do have a tendency to point out differences, and of course there is always a vulnerability to stuff like bullying, but But I think probably the most important note I could say on that, as someone, a young person who has had these conversations with kids for years, bullying feeds on insecurity, but it also is driven by insecurity. So I think for me, the strongest defense I could have is if I don't see being monocular as a weakness, and if I don't present it as a weakness, and if someone knows exactly how I need them to respond, they're not insecure in what they're saying, they don't see insecurity in me, and that is the strongest defense that I've been able to find. Like I don't have the best experiences. I've definitely had a couple instances with kids who weren't the nicest, but in recent years that's definitely been the biggest change, and something that I've found really strong against that, which of course it's not a perfect system. There are always going to be challenges, and it does take a lot of courage and work and strength to be able to eventually reach that point, but I think it is definitely very important. And so yeah, I essentially just wanted to wrap up and say that perspective is absolutely everything. Developing little things makes the biggest difference. Little tiny strategies that you might not ever even expect to have to put into action just make life so much better and easier as someone with monocular vision.